Starting from the one point, that is on the both the sides, we are having inguinal regions. So this is the prone side for inguinal hernia. Above is that femoral hernia. Then around the umbilicus, we can have umbilical hernia. Hiatus hernia is between the thoracic and abdominal cavity, where stomach moves around the esophagus. So that is called hiatus hernia. We'll discuss about this. Incisional hernia is definitely after any surgeries, when previously surgery has been done and after that patient, he or she is developing hernia. So that is called incisional hernia. Incisional hernia is a type of ventral hernia. Then we can have a epigastric hernia. In the epigastric hernia, Spigelian hernia and diaphragmatic hernia. Diaphragmatic hernia could be due to the weakness in the diaphragmatic muscle. Through previous various LSCS, even the scar for abdominal hysterectomy. So they are developing incisional hernia. Next. So this is the epidemiology of the hernia, that the global prevalence, there is a significant rise since 1990, because we could able to diagnose this incisional hernia. We are having a very good documentary evidence. So there is a tremendous rise, about 36% rise after 1990. And there are many risk factors associated with the hernia. And from our basic knowledge, we all know that the heavy lifting, obesity, they all produce the hernia formation. Next. This is the anatomy and physiology of abdominal wall. We are not going to discuss about that thing. Next, please. So coming to the current trends in hernia surgery technique, what we are doing at present. Number one comes is the open surgery. This is a time-tested surgery. Since our post-graduation days, we have learned that time the laparoscopic was not evolved, and we were taught about the open surgery. So there are different techniques to do open hernia surgery, Lichtenstein hernia surgeries. There are three types of hernia surgery. First is herniotomy, second is herniorrhaphy, and third is hernioplasty. Herniotomy means opening the sac and just tightening of the sac is called herniotomy. It is done particularly in pediatric age group. Herniorrhaphy, when this mesh was not available that time, we used to join the conjoint tendon with the inner lip of the inguinal ligament. So that is called herniorrhaphy. Means herniorrhaphy, will be a no use of mesh. But in hernioplasty, when the word comes plasty, so definitely we have to add something to give the strength to the muscle wall. So when nowadays we are using the different type of mesh. So when we are using mesh in hernia surgery, that the procedure become hernioplasty. Next, please. So after first laparoscopic surgery was done in 1994 in India, and the first surgery was laparoscopic cholecystectomy. It was done in Mumbai. After that, in 2000, laparoscopic cholecystectomy becomes the gold standard for gallbladder surgery. But hernia surgery, it becomes popular after say 2010 or 2012, because that most of the laparoscopic surgeon, they have learned how to do this laparoscopic surgery. So there are different type of laparoscopic surgery for hernia repair. Next, please. Now, come to inguinal hernia. There are two types of laparoscopic surgery we can do for inguinal hernia. First is called TAP surgery, TAPP surgery. TAPP means trans-abdominal pre-peritoneal surgery. In this surgery, we have to go inside of the abdomen. Means we have to cross the peritoneum. We have to go to the inguinal region, and we have to take out this inguinal content, and then we have to close this ring by putting a mesh. So this is called TAPP surgery for inguinal hernia. This is also becoming very popular, although learning curve is sometimes very high to learn the laparoscopic hernia surgery. But this is a gold standard treatment for laparoscopic surgery for especially inguinal hernia surgery. Next, please. The next surgery is called TEP surgery. TEP hernia surgery means we go above the peritoneum. So how we go above the peritoneum to close the inguinal defect? We have to inflate a specially designed balloon is there. We have to fix it with the cannula, then we have to inflate it. Nowadays, ready-made this device is available, which create a surface between the above the peritoneum, and by pressing the peritoneum lower down, we reach up to the inguinal region, and then we close the hernia. So this is called TP hernia repair surgery. But this surgery is much difficult as compared to the TAP surgery. Next, please. Now coming to the ventral hernia surgery. So this is called IPOM mesh. IPOM means intraperitoneal onlay mesh. So there are two types of surgery: IPOM mesh surgery and IPOM plus surgery. IPOM mesh surgery, we have to go inside the peritoneum, then we have to place the mesh to cover the defect. That is called IPOM surgery, and there is specially designed mesh for this IPOM surgery. And the beauty of this type of mesh, they never adherent to the gut of the abdomen. Next, please. So IPOM plus surgery, this is again modified form of IPOM surgery, where we have to first close the defect, then after closing the defect, we have to apply the mesh, especially designed mesh for this IPOM surgery. Next, please. Now, 10 years back, this surgery was developed because it was thought why one should go another way to do the laparoscopic surgery. Yeah, we want a minimal scars. So the standard port technique is always the 4-port technique, where we have to create a 4 hole in the abdomen, and then we have to perform the surgery. But here, this is called SIL surgery, single incision laparoscopic surgery, SILS. So here, specially designed port, which is to be introduced through the umbilicus. There is a big size port, around 20 millimeter size of port, and inside this port there are four ports. So especially scientists, they have developed especially instruments to work from this single ports, because it's a very cumbersome exercise to do from one port because of the ergonomics. So they have specially designed the instrument which are having a spatial maneuverability, so we can do laparoscopic cholecystectomy, we can do laparoscopic appendicectomy, we can do other procedures. So this is called single incision laparoscopic surgery. And but the learning curve is very difficult. So nowadays people have left this procedure to perform the laparoscopic hernia repair. Next, please. Notes is another form of procedure to perform hernia surgery. The full form of notes is natural orifice telescopic endoscopic surgery. Means we have to utilize mouth, vagina, rectum. These are the basically called as natural orifices. So endoscope is introduced through these natural orifices. We reach inside the abdominal cavity. Then we have to perform the laparoscopic hernia repair or other procedure as per the patient's requirement. So this is called nodes. Again, this is a very cumbersome exercise, but the surgeons, those who are very experienced, they are doing this type of surgery. Through this node surgery, they are even able to do the this cholecystectomy. They are able to perform the appendicectomy. They are able to perform the removal of tubes, removal of ovary. So many things can be done by nodes. Now, but it is not a very popular procedure. Now, next is called 3D laparoscopic surgery. 3D laparoscopic, because we are this is the advanced form of laparoscopic surgery. After 3D laparoscopic, scientists, they have developed the robotic surgery. In 3D laparoscopic, we have to use special telescope as well as a special screen, as well as one has to wear the these 3D lenses, because in 3D we have to we are able to assess length, width, as well as the depth of the tissue. So it is a very useful technique to perform any laparoscopic surgery. Here the camera is very important, because in the camera we are having in the telescope we are having two cameras at the tip of this thing, and all these, both the cameras, they work on the stereoscopic vision. So they give us the knowledge of the depth during the laparoscopic surgery. इसको रन कर सकते हैं क्या संतोष? Can we run? There is a video. This is a like I have recorded this video. Can we run this video? Not possible. नहीं possible नहीं होती है ना. So this I can show you how we can perform the 3D laparoscopic surgery. It's a very fantastic tool and it makes our job much easier. Next. क्या वीडियो है? ठीक है, छोड़ दो, तो अपन वहां रन करेंगे, वहां पे करेंगे, मतलब लोगों को एहसास करने के लिए what is actually है. So this is robotic assisted hernia surgery where surgeon is sitting just in front of the console and with the help of the assistant, the arms of the robot, they work, and definitely it gives a fantastic results because precision is fantastic, almost 100%. For mesh हो जाती है. Nowadays Darwin's system has arrived of 5th generation. That is very important, and this 5th generation, it is taking the advantage of artificial intelligence, which we call as AI technique, and these arms of the robots, they take the help of the AI system to perform the laparoscopic all laparoscopic surgery. Definitely it works on the 3D technology also. It is very costly. The cost is for minimum cost for robotic surgery is 5 to 6 lakh rupees. Again, another technique that is called abdominal wall repair, AWR. The entire world of hernia surgery is going towards the AWR because here we are using the principle of component separation technique. Component separation technique means we have to, suppose if you are doing the surgery for abdominal, any ventral hernia or incisional hernia, so we have to separate all the components starting from the external oblique, internal oblique, transverse abdominis up to the lateral margin of our abdomen, and after that we have to joint all these muscles in an anatomical way. So this is called AWR, abdominal wall repair. The concept behind is component separation technique. So different type of meshes are available, synthetic mesh, biological meshes. We'll discuss about all these things in upcoming slides. Next. So these are the different type of mesh used in hernia surgery. This is called polypropylene mesh. This is soft polypropylene mesh, and this is a very conventional mesh we use in all type of inguinal, ventral, umbilical type of hernia, and it is very cost effective also. Now this is called composite mesh. Here they have incorporated two chemicals. One is called polygactylene, second is polypropylene. So this is called a composite mesh. Better result than simple polypropylene. Now this is photograph from the biological mesh, and we have applied this biological mesh for entire abdominal wall hernia. This is biological mesh, and it is now scientists hernia. Nowadays we are having 3D print technology, and soon we are going to have another form of inguinal hernia repair, but a different 3D printed technology of this type of meshes. So we are having plug type of method. These are basically pre-formed inguinal hernia meshes. Next. So this is called mesh fixation device. So these mesh fixation device are two type: single point fixation and double point fixation. Better results we are giving with the double point fixation device, and there is a special, there's a gun, and these you can understand this fixator is just like a small 1 to 2 millimeter size of screw. They are in two forms, absorbable as well as non-absorbable, and definitely this gun is costing around 30,000 rupees per gun. Again, now there are two school of thoughts. Some surgeons, they provoke hernia should be repaired with the mesh, and some surgeons nowadays it's time to go again for mesh free hernia repair. So there will be no complication with the mesh. There will be less chronic pain, and it is suitable for selected patient. I am using this mesh-free hernia repair, especially those elderly patient when we are expecting there will be some type of mesh infection. So this Sharda's method is one of the best example of this mesh-free hernia repair. Next, please. Where in the Sharda's method, we are using in place of mesh, we are using the sheet of rectus muscle. So we are using sheet of rectus muscle in place of this mesh. So basically, it is a autologous graft. Autologous ही बोलते हैं ना, autologous from the immunojyoti. It is just like mesh. So these are the schematic representation how we are placing the mesh. So there are different type of onlay mesh, inlay mesh, sublay mesh. Sublay mesh, when we are keeping the mesh over the peritoneum, so that is called sublay mesh. IPOM means intraperitoneal onlay mesh, where we are keeping the mesh over the gut to close the defect. So this is onlay and sublay. And inlay means this is the very beautiful comparison of techniques, and all these data, they suggest that definitely laparoscopic surgery is much better than open hernia surgery. 3D laparoscopic surgery is better than laparoscopic surgery, and of course robotic surgery is better than 3D and this conventional laparoscopic surgery because of the precision. Patient selection criteria, we should follow the standard guidelines. Always clinical assessment should be done in a proper way. Ethical consideration should be taken properly way. We have to assess the benefits of mesh as well as chances of mesh infection post-operatively. So we have to keep all these things before going for any hernia surgery repair. So there are three types of hernia. Just I'm giving the overview of this: reducible, irreducible, and strangulated. Next, please. Reducible, when we can reduce the content. Irreducible, we can't reduce the content. And when the blood supply of that segment of gut is hampered, so that becomes the strangulated hernia. These are the different risk factors for development of the hernia: obesity, constipation, heavy weightlifting, congenital defect, chronic cough, muscle weakness, smoking, pregnancy. All these things leads to hernia formation. Next. So these all these things leads to the defect in muscular valve. Then there will be increased abdominal pressure, which will lead to the formation of hernia. Next. How to diagnose hernia? Important is the history. Then physical examination is very important. 90% hernia we can diagnose just by doing the physical examination, and then rest of the things depend upon the availability of ultrasound machine, CT scan, and other investigation modality. Complications after hernia surgery: post herniorrhaphy pain syndrome. It is because of the entrapment of ilioinguinal nerve or hypogastric nerve, hernia recurrences, wound infection, mesh infection, ischemia. All such things can happen after the hernia surgery. So now coming to the very important point, what's innovation is going on in hernia surgery. So three important things nowadays the scientists, they are working on: 3D printing, number one. Second is nanotechnology to enhance the function of the mesh, and third is stem cell based hernia surgery. Next, please. In 3D printing hernia surgery, this is it has going to change the entire concept of hernia mesh for repair, because we are getting at present the hernia mesh in a preformed structure, and we have to cut it down. But 3D print technology will assess the patient's demand, will assess the size of the defect, will assess how much length of the mesh will be requirement, and this will give the exact size of the mesh to place the to cover the hernia defect. So this is going to एक मिनट back एक मिनट नहीं आएगा, चल कोई बात नहीं. Again, it will be a patient specific model, and 3D print technology giving us the surgical guides, especially designed this shear will be there, which will take these meshes into the proper place. So this will help in important remodeling of the tissue, strengthening of the tissue, and it is a part of the tissue engineering. Next. Second thing is use of nanotechnology for giving the best meshes for the surgeons. So there will be a nanoparticles of silver. Then they are going to use different other chemical forms of bioparticles, which will be implemented in the mesh, which will be antiseptic, which will prevent the infections. So the scientists, they are working on this use of nanotechnology for the best outcome from the mesh side. Next. Now, stem cell based hernia surgery. In stem based surgery, the stem cells are taken out, and in the form of seed cells, they are again sprayed over the meshes in form of injections, in form of scaffolds, and again it will be a the innovation will be, I think at present I have not seen stem cell based hernia meshes, but soon it is going to be available in our medical field, and I hope that this mesh is going to be very effective for hernia surgery. This is the regarding we are going to conduct a 28th Association of Colorectal Surgeons of India's instructor course as well as fellowship examination in the first week of April in AIMS. So all of you are welcome there. Thank you very much for patiently listening. कैसा भाई बता